Hello, I'm Benjamin Brucker. I'm a urologist and urogynecologist in New York, New York. And I'm joined here today by an esteemed group of physicians that I'd like to have them introduce themselves to tell us a little bit about who you are and your practice.
So my name is Carolyn Eccles. I'm a urogynecologist in the Philadelphia area. And I see the gamut of patients in urogynecology, including urinary incontinence, pelvic organ prolapse, as well as some pelvic pain. I do also integrative medicine as well.
I'm Christina Escobar. I'm a urogynecologist here in New York City. I similarly treat a wide range of pelvic floor disorders, anywhere from incontinence to pelvic organ prolapse and to other common disorders of the pelvic floor.
And I'm Kate Arnold. I'm a general OBGYN, and so I am working as Chief Medical Officer at Watkins Conti. I practice general OBGYN, so full scope OB and GYN practice.
I wanted to start the discussion talking about a condition that's actually a very prevalent condition, stress urinary incontinence. So can you guys tell me a little bit about what stress urinary incontinence is?
So stress urinary incontinence essentially is when there is pressure that normally happens in the urethra, which is the tube coming from the bladder. And when it's weak, the muscles of the urethra are weak, then any pressure that goes against the bladder causes leakage of urine, and that's stress urinary incontinence.
Christina, tell me a little bit about what a patient may be experiencing if they're having stress incontinence.
Women with stress incontinence often experience leakage when they cough, laugh, or sneeze, but they can even experience leakage with exercise, with walking, with doing basic tasks such as bending over and picking up a child or just carrying a heavy shopping bag. So it is something that impacts a person's quality of life quite heavily.
And Kate, what are some of the things that women do to help sort of cope with or manage with this really troubling quality of life condition?
Yeah, that's a great question. Unfortunately, a lot of women end up not being able to do things they enjoy. So we hear a lot about, like I wanted to go play with my kids at that trampoline park, or I wanted to go play with them on the playground, but I couldn't, or not being able to get back to normal exercises. So we've heard I used to love kickboxing or I used to love pickleball, and I just don't do those things anymore. And so we actually see it a lot with coinciding with depression as well, because you take away things people like and it's really hard.
Yeah, I can imagine quite a stigma and sort of a taboo thing to talk about incontinence. I can't think of any celebrities out there that are holding up the banner saying, look, I leak when I go to the trampoline park with my kids. So I can imagine a lot of women are actually suffering silently. Tell me a little bit about how this condition affects people of different ages. And who are the typical patients you guys are seeing, or friends that you have, or people that you know, family members that have to deal with incontinence?
Well, it starts actually in reproductive age, and mostly when women have been pregnant and have had children. However, it can occur in women who have not. And then it can get worse. And so women who become perimenopausal or menopausal, this leakage becomes worse. And so it's really, really important to start treating early so that it doesn't get worse.
And Christina, young women, old women, how does it affect young women versus old women? Are there differences in how they have to manage and cope and what they might complain about when they see you in clinic?
Yeah, I think for the younger patient, it's really about limiting how they're doing their normal activities. Young women often speak about wearing different color pants to the gym so that when they do leak, that leakage isn't apparent. Women say, I don't wear light colors anymore because if I cough and I'm wearing something light, you can see the leakage come through. And I think for older women, it really impacts their sort of quality of life in their best years. They want to travel, they want to go on that trip, they want to take that hike, and they're unable to because the leakage is embarrassing when it happens. So I think in both sort of the younger generation and the older generation, when they do get this, it's pretty impactful in their quality of life across the board.
So, Kate, can you tell me a little bit about the comment that I often hear when patients are finally going to come in and see me and we start asking these hard questions about leakage, and they say this is just a normal part of aging. This is just sort of what happens when I get older. How do we sort of counsel patients, or what advice would you have for patients if they felt like leaking and not being able to do the activities that they like is just part of getting old?
Yeah, I think it goes back to the point you made earlier, which is that it's embarrassing to talk about. And so many women, before they talk about it at their doctor's visit, they're talking about it with their moms and grandmas and aunts. And I think that's something that gets passed down a lot is, this is normal. That started around, your age for me as well. And I've just kind of learned to live with it. And I think we do need to work harder as a medical culture of making sure we're doing a good job screening for this and making it easy for patients to talk about it so they can get treatment.
Yeah, and I usually will use the analogy, things like getting gray hair, a normal part of aging, and some women don't want to have gray hair, and you take action. There are other things that get more common as people age, like cancer, and it doesn't mean that we don't screen for cancers because we want people to be healthy and have a good quality of life. Another sort of, I guess, concerning fact is women that have stress incontinence often take about 7 years before they come forward and see a provider or sort of find a doctor to talk to or a healthcare professional to talk to. Can you comment maybe a little bit, Christina, on why it takes so long for patients to finally acknowledge that they have a problem that's bothering them?
Yeah, I mean, there's a couple reasons that this could be happening. One is the pure stigma of just bringing it up. Women can be embarrassed about, talking about it. Some may not understand who to talk to about it. Is it best with the primary care to discuss this? Is it best with their gynecologist? Most women don't end up seeking a specialist themselves. They go to the doctors who have been caring for them of their general life, concerns. And so I think there's stigma about talking about it, concern about who to bring it up to. And then sometimes women, when they do bring it up to the healthcare provider may not be well versed in who to send them to or what things to talk about or to offer. So I think there's many different layers in our system that we can really look to improve a woman's access to care for this problem.
And a condition like stress urinary incontinence or the involuntary loss of urine is quite common. And maybe take us through the treatment algorithm or what can we do for patients or what does the healthcare system do for patients that might finally decide to come forward and say, look, I don't want to live my life wearing a diaper or worrying about what color pants I'm wearing. Why don't you walk us through that a little bit?
Exactly. So first and foremost, it's really important to listen so that you figure out what's impacting the woman that comes in to see you. And so as far as starting off with the beginning, there are pads, absorbent pads that they can get that are sold in the supermarkets. It winds up being a little expensive, and although it works, it's not a treatment per se. It just kind of puts a Band-Aid on it. Next, we could do things like pessary treatments. There's also a device that just came out, a Yoni.Fit device. The pessaries are used for prolapse as well, which is when the organs fall. But the Yoni.Fit device is specifically used for stress urinary incontinence. And so that's another option. There's also surgery. And surgical options include bulking procedures in which we actually place material kind of next to the tube coming out of the bladder in order to help strengthen the muscles and increase the pressure so that urine doesn't come out. And then there's a sling, which mostly it's really mesh that we use underneath the urethra to kind of support the urethra. But there's other materials that can be used as well. But what happens is sometimes patients don't want surgery. Some patients just want to delay surgery, and some patients cannot have surgery. And so there are other things like lifestyle changes, physical therapy, which can help strengthen the kind of voluntary muscles that strengthen the involuntary muscles in the vagina. So there's a lot of things out there. We can help them, and that's really important for them to know.
Great. So it sounds like there are quite a few treatment options. Sort of want to dive a little bit more into it for women out there that might be dealing with this condition and be told to go to a physical therapist. Kate, tell us a little bit about what's the downside to physical therapy? What's the practical, how do people do physical therapy to try to help their stress incontinence?
Well, that's a good question. I mean, I think starting off, you three are the gold standard for treatment for stress urinary incontinence. In my office, I'm much more limited. Doing a pessary is cumbersome, and I don't do the surgeries that you all do to fix this. And so from a general OBGYN standpoint, physical therapy used to be one of my only options. And physical therapists are wonderful. They're fantastic. They make the patients feel comfortable, but It's a lot of resources to go to pelvic floor physical therapy. It's costly, it's time off of work, there's often wait lists, and it's going to take time for them to get better if they do get better.
Christina, tell me a little bit about stress incontinence surgery. Tell us a little bit about maybe the benefits and some of the downside to having a surgical procedure to treat this condition.
Yeah, so there's two options for surgical procedures, as Dr. Eccles mentioned. There's a office injection that can be done where you inject a filler gel into the urinary tube. And this is something that women often choose if they're considering sort of a go-between between the conservative options and actually getting general anesthesia. And the efficacy of this is somewhat limited. We have some good data that has come out, but the efficacy is not 100%. And the downside is you do have to keep getting these injections, and they can be uncomfortable to get in the office because, again, you're not under general anesthesia, you're getting this under local anesthesia. The second option is a surgery where you do end up getting general anesthesia, and this is a strip of mesh fabric that we place below the urinary tube. It is effective in preventing leakage when you cough, laugh, sneeze. However, there are downsides to this option, including you do have to get general anesthesia, and it often requires some time off work, which many women who have busy lives and jobs actually can't afford to do. So benefits and cons to the surgical options for sure.
So I wanted to talk a little bit about pessary, which was mentioned a couple of times. It sounds like there are some issues. Let's say you're not a specialist that deals with incontinence on a regular basis. So maybe I'll ask the specialist here. So if a patient wants a pessary, a more traditional pessary, what is that? How does your office set up for that? And tell us a little bit about what a pessary fitting is.
So when a patient desires, treatment with a pessary, it takes pretty much a few visits. So they have to come in, and there are a lot of sizes and shapes. It's made out of silicone. There's one made out of latex, but we don't really use that anymore. And they're a little more rigid, but what happens is they have to have a fitting. And so they come into the office. The fitting takes approximately maybe about 30 to 40 minutes because we need to fit them to make sure that it's the proper fit, make sure that it's comfortable. They need to walk around. Some patients I actually instruct to go to the bathroom to make sure it doesn't fall out. And so it tends to be a little cumbersome, and sometimes they even have to come back after a few weeks. Once we figure out that the pessary is working for them, sometimes it just doesn't fit, and so they have to come back to get refitted again. And so there's multiple visits. If patients can't take them out on their own, then they'll come back every 2 to 3 months for us to do it. So there's a lot of visits that occur. It's not a streamlined process.
So you mentioned having to take them out and put them in. So what would a reason be a woman would want to take out an anti-incontinence pessary?
Well, sometimes what happens is they'll leak with certain activity. So for instance, I have a couple of aerobics instructors that leak during their classes, or even leaking with playing with children. And so, but they don't leak in other places and other times. And so they'll use the incontinence pessary to be able to not leak at the time when they don't want to, and then take it out.
And so I think another concern for a younger sexually active woman is also, can I be sexually active with a pessary in? And Christina, tell us a little bit about specifically anti-incontinence pessaries and how easy or difficult or not easy is it to remove, replace, for example, in a younger patient of yours that may be postpartum and is having leaking issues, but wants to use something like a pessary?
Yeah, so the original anti-incontinence pessary was actually designed for prolapse, and they just added an additional part to it to treat the incontinence. So it's shaped like a ring, and it has a little knob on the end. And for women to put it in, they have to fold it, insert it, and then spin the knob around to the front. And I find that I have a lot of patients have difficulty, rightly so, spinning this cumbersome little knob around to the front and then maintaining it in that place. It can shift around when you move. And the knob often when I change them is sort of fitted to the back and making it not effective for the patient. So it does become cumbersome to insert for sure, because you have to spin it around to the front, cumbersome when you're wearing it, and then to remove it, you can't just remove it if the knob is facing in the front. You have to spin it around to the side again, then fold it, and then remove it. So for my young sexually active patients, for my young patients, or any patients who are wearing it in situations, meaning I play tennis and I put it in, or I'm an aerobic instructor and I put it in, it does become a process to take it in and take it out.
So we were talking a little bit about the process of fitting for a pessary or an anti-incontinence pessary, and certainly, as you mentioned, as a generalist, you may not necessarily have all the inventory in your office. It sounds like there are lots of shapes and sizes that we need. We did mention Yoni.Fit, new product that's available for the treatment of stress urinary incontinence. And can you take us through a little bit about how this intravaginal insert is different than an anti-incontinence pessary in terms of the office logistics, or perhaps you as a generalist and sort of how you'd end up using this in your practice?
Yes, absolutely. That is honestly the reason that I joined Watkins Conti, because the Yoni.Fit makes it so I can treat stress urinary incontinence. When I tried to prescribe a pessary, I mean, it was all of those steps, but nothing going even that smoothly. So I was often trying like many pessaries, and the patient needing multiple visits to come in and keep trying, and then neither one of us really feeling good about things at the end of the whole process. With Yoni.Fit, it is FDA cleared to treat stress urinary incontinence. If you just look at it, it's not nearly as intimidating as a pessary. I mean, we've talked about the Gellhorn, but they're big devices. They're thick and they're not very pliable. And so even just looking at this, it makes me excited to prescribe it, because it's easy for me to put in, it's easy for me to take out, and that's going to be great for patients. It's exciting because there's so much pseudoscience out there in women's health. This device and this company have been through clinical trials to demonstrate that this is effective. It's FDA cleared. This is what it's designed to do, is treat stress urinary incontinence.
And so I think one of the things about Yoni.Fit that's actually really nice, and I think the way the trial was designed, was patients were really identifying themselves as well. And it gives us a lot of confidence as clinicians to know that we don't need to do all sorts of fancy testing or poking and prodding. Patients will say, I have this problem, and they're actually pretty good at identifying when they're leaking from physical activity. So it's exciting that we have a new option for the treatment of women with stress urinary incontinence. And tell us a little bit about this new product and how, as a prescriber, I can actually use it with my patients.
So prescribing this is really easy. We want this to be something that can be prescribed by family medicine doctors, by OBGYNs, by urogynecologists, and by doctors and APPs. So this really broadens who's able to treat stress urinary incontinence. If the provider and the patient are comfortable with vaginal exams, then there'll be an exam that sizes them, and that prescription will match the size they need of their Yoni.Fit device. If for some reason there's not a vaginal exam that's done, maybe it's a telehealth visit, then they can prescribe a telehealth kit, and then the patients can use that as well.
I'd like to ask Dr. Escobar and Dr. Eccles, who were two of the PIs on the study that led to FDA clearance for the device, how often was it that you had patients in the trial that were not able to be fit for one of these intravaginal inserts?
You know, I think that's one of the things that I found very interesting about the study as we went through it, is that patients were actually able to select their size, and we had 0 patients in the study who were not able to be fit with the Yoni.Fit.
So the device actually, you sort of give patients the option of sizing themselves, and they're able to find a size that works for them. I want to talk a little bit more about the data behind it. And we talked about there are lots of treatment options out there. I asked you to compare and contrast some of the other options out there. How good is this device? How well does it work?
Oh, I mean, patients really responded to the device and using the device very well. There was over 96% response to decreasing the stress incontinence episodes, which is amazing. And I got to tell you, I have some patients who just cannot wait to be able to use the device now. Keep knocking down my door, waiting to see when we can give this prescription so that they can go ahead and have this device.
Any other insights, Dr. Escobar, things that maybe were wow factors when you saw patients back at the end of the trial or during the trial of the device? And this was a sham-controlled trial that was run, so meaning there was a fake device that was inserted as well as the actual Yoni.Fit. which is sort of the most rigorous way you can test a device. But if we, regardless of sort of the hard data, which we can talk about in a little bit, what were sort of the take-home messages you had from patients in terms of the efficacy, how well it worked, how it changed their lives?
Yeah, when compared to the sham device, the Yoni.Fit reduced their leakage episodes in about 50% of patients by 50% of the pad weight. So people were coming back with pads that were significantly more dry, if not completely dry. And so I think that is really the biggest take home from the study is you're able to give a woman who was struggling with having pads that were wet or struggling with leaking outside of the pads better control over that leakage and a better ability to be dry.
Dr. Arnold, can you tell me a little bit about how a patient may use Yoni.Fit?
Yes, absolutely. So as opposed to a pessary that's left in for months, this is left in for a maximum of 12 hours a day. And some patients use it that way. They wake up, they put it in, they go about their whole day with the device in place. Some patients just use it when they need it. So we've talked about all the times people leak, whether they're playing with their kids, exercising, trampolines are dreaded things. So they may just use it episodically like that when they need it.
Great. Tell us a little bit about the clinical trial that was done for the FDA clearance for this new exciting intravaginal insert.
Yeah, absolutely. So the trial was done at 3 different sites, all prestigious medical centers. It was done at NYU Langone Health, it was done at Thomas Jefferson University, and at Stanford Medical Center.
Dr. Escobar, tell me a little bit about the actual device, sort of demystify it a little bit. It's very not intimidating, certainly compared to some of the pessaries as we were talking about. They can be real scary, but just walk us through what the device is and where it sits and how a patient or a doc would put it in.
Yeah. So you're right, it's not intimidating and it's not scary, and it actually is quite intuitive to use. It's a silicone-based medical device that a patient would insert under the urinary tube, right where the urine comes out. It's going to provide gentle support to the urinary tube to help prevent leakage when they cough, laugh, sneeze. And it should fit comfortably within the vagina, and when fit comfortably, they shouldn't even know it's there. To put it in, they compress the device and fold it, apply lubricant to the edge, and then insert into the vagina where it'll open up. And then to remove it, there's actually a very useful tab, which many other devices do not have, and all they need to do is pull the tab to remove it from the vagina. And most patients were able to do this successfully, comfortably, and actually, after even just 1 or 2 uses, said it felt like second nature.
And there's a small tab on the end of it, and the tab actually rests sort of in the sort of dependent portion of the vagina, so it makes it actually quite easy for patients to remove.
Yeah.
Having sort of the early experience with this device and patients and sort of the feedback that they gave you, what should clinicians expect when they prescribe this device to patients?
I mean, this device was extremely useful, and in the study, patients really reported that it was much better as far as significance regarding usefulness versus the sham device. And I actually have, and I was saying earlier, I actually have a patient that was in the study that is begging me to basically hurry up and get her this device because it really, really helped her. And so being that, it's helping patients stay dry, this is something that we need to start doing as soon as possible.
I think, I found that it really fit a need of what the area to treat stress incontinence needs right now. We do have surgical and procedure options, and we have conservative options, but the sort of non-surgical options that exist aren't perfect as they are, and they either require time, like physical therapy, or they were made for a totally different pelvic floor condition, like pessaries. And so this really satisfied a need for patients who are looking for a non-surgical treatment that they could self-administer and do a good job at taking care of their stress incontinence.
With any product or any device or any surgical procedure, there are always potential side effects, some scary, some not so scary for women to deal with. Tell us a little bit about what women can expect or what sort of side effects from the Yoni.Fit.
Yeah, the side effects in my experience are typically very mild. Some women may have spotting or just a light amount of vaginal bleeding, and that tends to get better as they use the device. And we primarily see this in sort of the patient who's post-menopause who may need more lubrication on insertion, and we can sort of help as a clinician correct that with some tips and tricks in the office. Some patients, as they learn how to fit the device, can describe discomfort, but really when the device is well fitting, the discomfort should go away. They shouldn't even feel that it's there.
So Dr. Arnold, if a patient decides to use this intravaginal insert to treat their stress incontinence and they are having some issue with the device, what are sort of the steps that they should take?
The first step would be looking at the instructions for use. So Watkins Conti has developed a great document that's included with every fit kit that goes over exactly what to do and how to do it. So it starts with cleaning the device right when you open it. It goes over how to fit it, like you were describing, and then it goes over removing and what to do if you can't remove it. So the instructions for use are the first stop for any patient. And then there's also resources for what to do, including a website and a phone number if there's questions after that.
So I just wanted to walk you through one of the provider kits. Comes in this great box and sort of tells you a little bit about the product. And for patients, there's sizes 1 through 6. Again, this is a 100% medical grade silicone. They're color coding to help, matches along with the patient use instructions. What I also really like is that Watkins Conti actually also gives us a storage case. So the device can be worn, again, for up to 12 hours, but if a woman decides to take it out and store it, there are nice perforations on the bottom of the storage case, and then it can be put away for safekeeping. Also provided a small cleaning brush, so if there is any debris or discharge on the device, it can be cleaned as well.
So as Dr. Brecker mentioned, this is the provider kit, so this will be in every provider's office. When they prescribe a fit kit for a patient, the patient will generally get 2 out of the 6 devices, unless it's the telehealth kit. When they do the exam, they'll go through and decide that the patient is either a purple size, a teal size, or a pink size.
And then we
based
have
on
sort
their
of
vaginal
color coding
exam.
here, so pretty easy to use, and you can see the different colors here, little size.
Yep. And we have provider instructions. So when the provider does the assessment of the mid-vaginal width, there's instructions that literally they can put their fingers on this measuring device and it will tell them which color kit to prescribe.
So in your guys' opinion, what is it about Yoni.Fit that really simplifies the process for women getting finally treatment that's effective for stress incontinence?
It's great, and that's a great question because it streamlines the process of being able to figure out a treatment option for these patients. They don't need multiple visits. They can actually help self-fit if they cannot get into the office. They don't have to take time off of work. They can delay surgery if they need to. Or if they don't want surgery, they can use this as a temporary measure. So that's definitely the advantage.
So Dr. Escobar, having experience with the Yoni.Fit, how do you think that this is going to benefit women?
Yeah, I think it's going to be a huge benefit for a woman who's interested in a non-surgical option where they can self-fit the device and really have control themselves over their leakage of urine. They can choose when to wear it, when not to wear it. They can go up a size, they can go down a size. And I think that's also a benefit of having a device that is 6 sizes. It acknowledges that every woman is different. And also every woman may change with time. And so I think the fact that it does come in so many different sizes and a woman can change in between them is something that is unique about this device.
I think it's great that women have an option of something that can be used temporarily, very easy to remove and replace. And I think that in terms of efficacy, it's really astounding when you have a woman that's been wearing diapers and she uses the device and comes back and says, "Doc, I'm totally dry." And you can see the demeanor changes, her sort of way that she walks into the office changes, just sort of that confidence that she really deserves. So tell me a little bit about why treating stress incontinence is so important.
Well, first of all, it is very common in women, and this is something that stigmatizes women when they have it. And it causes depression, it causes a decrease in quality of life. It's so important that we really, really, really ask the patients this. It's part of the PQRS, which stands for Physician Quality Reporting System, which is very important in Medicare, and that's how we get paid. And so asking about incontinence is very important as well for that.
And it's not hard to screen for. I mean, women are smart. If you ask a woman if she leaks when she coughs, laughs, sneezes, or moves, and she tells you yes, she's accurately diagnosed herself with stress incontinence.
I mean, also it's in the review of systems. So they can, I mean, we look at that, and if that's positive, then we screen for it.
Yeah, one of the great things I think is there are so many women out there that suffer with this, and there are just not enough specialists and subspecialists to treat the condition and all the women that are suffering. So now that there's finally a product where a woman can really self-identify, know that she's having an issue, simple consultation with the provider via telemedicine consultation, and ultimately get a therapy that's going to be effective to treat her stress incontinence, I think is really quite transformative, really for the whole space and for women, hopefully across the globe. So Dr. Arnold, having been around the country and sort of talking about the Yoni.Fit, who do you think really is the right prescriber for this intravaginal insert?
Everyone. I mean, the way that this clinical trial was conducted, the way that patients are able to identify both the diagnosis and what size they are, we believe that any medical provider can prescribe this. So we want like the rural nurse practitioner whose patient can't make it to an OBGYN, let alone a urogynecologist's office, to be able to prescribe this. We want a urogynecologist who's booked out like 3 months for surgery to be able to prescribe this. There are just so many places where this can make a difference in patients' lives. And so we want it accessible to all medical providers, all patients. Another thing about this is that, we're all supposed to be screening for stress urinary incontinence. I mentioned as a generalist, I didn't have a lot of treatment options, and so it was kind of humiliating to screen for stress urinary incontinence when a woman opens up and shares that she leaks and I don't have a great solution for her, because the urogynecologist, you guys are just not that many of you. And so with this, now I feel more confident screening. Now I feel like I can ask a patient, hey, are you leaking? Is it bothering you? Is it impacting your life? Because I know I can give her a solution that day.
Yeah, we don't want to ask patients about things that we don't have solutions for. And as a specialist, it may be very easy for me to, tell them all the different options that they have. But I agree, there are probably a lot of providers out there that don't even want to talk about it. And then those that sort of do talk about it, the patients get discouraged. They were finally brave enough to come forward and tell someone that they were having leakage or incontinence after childbirth, and then they're told to see a specialist and they have to wait 3 months to see someone, let alone to get therapy. The nice thing about Yoni.Fit as well is it works right away. You put it in and it really starts to make a difference. And so in some ways, I don't know that there's anyone that has stress incontinence that shouldn't try it, because it really may make quite a difference. Are there any take-home messages that you have for women that may be suffering out there about coming forward and getting treatment for their SUI?
Absolutely. Talk about it. Tell us your problems. If you're leaking and it's affecting your quality of life, it can be treated. It's not a normal part of aging. It's not inevitable. And so definitely you need to open up, and it's okay. There are solutions, and there are simple solutions out there.
Yeah, I think I would echo all those and just say there are good treatment options, and there are good treatment options that are easy and available, and to talk to a provider, because you may be surprised about how your quality of life changes once you become more dry.
So we were talking about stress incontinence and how a lot of women actually end up delaying coming forward to talking about it because it is stigmatized. Then they finally come forward. Can you talk a little bit about how you think Yoni.Fit might fit into this patient journey?
Yeah, when I see a woman with stress incontinence, I often give them all the options on the table, everything that's available, and have them tell me what fits best with where their life is at the moment. And I think the most important thing about treating stress incontinence is to find a treatment that really fits with where the patient's at. There are some women who are ready for surgery when you see them, and there are some women who are not ready for that and may think might be ready later. Some women may have demanding jobs that are seasonal and may say, I need surgery, in the winter because that's when my busy season is over. I treat a lot of patients who are teachers who say, I really want surgery, but I'd like to wait till the summer when school is out. And so Yoni.Fit may fit in those journeys as a temporizing measure until they seek the surgery that they want, or they're able to have the surgery that they want.
So certainly seems like it's a great option, and it may not be the solution for everyone, but can fit in regardless of what they're choosing, whether it's waiting to get in to see a physical therapist, whether they're at the therapist and it takes a few weeks for the physical therapy to start to work. I think those are other great ways with which this product can actually get women relief.
And there's also patients who just don't want the surgery. And so this is definitely a great option for them.
So the therapy that we've been discussing, very effective, but let me be the one to ask, what's it going to cost patients?
That's a great question. We want this to be accessible to all patients. So from a provider standpoint, we have reimbursement codes, and from a patient standpoint, this should be covered by insurances. If it's not covered by insurance or a patient doesn't have insurance, the out-of-pocket is $125.
So very reasonable. I mean, I think that, I don't know what it's up to now, but the pad use in the United States is over a $2 billion industry, and those are probably old numbers. So you can imagine if this is something that actually makes patients dry or drier where they're not needing pads, in some ways I think it's really well worth the investment. Great to hear that there will be reimbursement. The nice thing about Yoni.Fit is, as a provider, I don't need to lay out money to buy all sorts of different pessaries and shapes and sizes that I may never use. I have a kit that I can utilize to sort of show the patient about what the device is, and then this is something that I'm going to prescribe that will get sent to them, for example, by the pharmacy. So one of the issues that we deal with as urogynecologists that use lots of traditional pessaries is when we're sizing a patient with a pessary and we decide that a different size works better, I can't just throw the pessary out. I need to sterilize the pessary, clean it, and then store it so it can be used with another patient. With this new intravaginal insert, Yoni.Fit allows me to not have to worry about that. So it really just streamlines things not only for me and the patient, but for the staff and the flow in my clinic.
And the cost.
I think that's a big point. So how representative was the clinical trial for patients that have stress incontinence across the United States?
Oh, the clinical trial definitely represented a diverse patient population, and pretty similar to what I see in my office. When looking at the numbers, is actually the diversity was a lot better in this study than some of the other studies that are on incontinence in urogynecology.
And Dr. Escobar, is stress incontinence something that affects one group and not another group, or is this something that affects all women?
Yeah, this is something that affects all women at all ages, at all points in their life, whether it be in their reproductive years and into their menopausal years and postmenopausal years.
So unfortunately, for lots of physicians, healthcare providers out there, if a woman does come forward complaining of issues with leakage, coughing, laughing, sneezing, really the only option they have is pads, and pads dominate the market. Now with Yoni.Fit, there's an option that exists, and it's really quite a safe and efficacious option to treat and help women. Do you have any advice to the provider out there that may be a little intimidated about asking these questions and then potentially even prescribing the Yoni.Fit?
Absolutely. I mean, to the family practitioner, to the advanced practice provider, who is not comfortable with vaginal exams, this is definitely a safe and efficacious way, and pretty much the only way to treat stress urinary incontinence besides pads, which is going to cost the patient a whole lot of money. And so do not be afraid to prescribe it.
So Dr. Escobar, you're someone that does a lot of teaching and education of fellows and residents and medical students, and one of the things that you do teach is vaginal examination. Is this something that people need specialty training on how to do if, let's say, a family provider or an APP that doesn't have a subspecialty in pelvic floor health would need specialty training to be able to help fit a patient for one of these devices?
No, I think one of the really nice things about this option is that women can self-fit. And so if someone is feeling uncomfortable with their vaginal exams and, uncomfortable sort of starting that part of their practice, then a patient who's comfortable with it can fit themselves for the device. And that just expands access to care and access for options. I think we've seen also telehealth really sort of skyrocket in the last few years, and this provides a nice complement to that. if you see a patient over telehealth, maybe either you've seen them before, this is the first time you're seeing them, and they're comfortable enough fitting themselves with the device, it could be a great option for them.
So one of the things that's very apparent reading this pivotal trial is that we do need to trust patients, and patients actually do a very good job identifying that they have incontinence. And it really is a call, to arms for patients out there to say, look, I have this problem. I know that I have this problem, so I want to go talk to a provider, and a simple telemedicine visit might allow them to get a prescription for a Yoni.Fit. They have their self-fitting kit at home. They do it in the privacy of their house, and now they have an effective therapy to treat their stress incontinence. Any other advice for providers in terms of things that you might think would be barriers for them, or what they might perceive as barriers to begin prescribing?
Yeah, absolutely. Watkins Conti, we are devoted to this product. We believe in it, and we want to support providers who want to prescribe it. So if you're concerned about, gosh, this is new for me, that's okay. Please get in contact with us. We'll walk you through it. It's very simple, and we believe that you can do it.
And I believe that you guys are really investing in a patient population that's going to benefit tremendously. We heard from some experts today about all the different options. And look, surgery can be scary, and physical therapy may not be an option for some people. Pelvic floor physical therapy is an even more subspecialized type of physical therapy. But now we have an intravaginal insert that we can offer. Any take-home messages for providers out there, Dr. Escobar, in terms of maybe your experience having used this device in the real world, and what sort of benefit patients may derive from it?
Yeah, I think it really just puts a little bit of the power in the patient's hands, right? They're able to sort of put this in on their own, take it out on their own. It gives them control over their symptoms and a little control over their life. And I think when we partner with patients to deliver this type of therapy, it can be really impactful for both parties.
Anything that you want to sort of parting words for women that may be suffering on the sidelines, and what you want to inspire them to do?
I inspire them to come forward.
It's as simple as that.
It's simple to come forward and talk about it, because we do have options, and one of the options is simple and efficacious.
So I'd like to thank Watkins Conti for allowing us to talk today about such a prevalent common condition. Yoni.Fit.com is a website that exists, so if providers out there, patients out there want to find out a little bit more information, there are some resources for them to go to. So I think what we learned was this is a common condition. Women need to take ownership and speak out, and providers need to be aware, willing, and able to prescribe this efficacious and safe therapy. So I'd like to thank you guys. Take care.